This is the third presentation on the muscular system. We will continue to look how muscles contract, and then we will finish up by looking at what happens to the muscles with age. The muscle contraction is called the sliding filament theory. We already studied that a nerve impulse arrives at the terminal, the very end of the nerve, and acetylcholine is released. It goes across the synapse, and then acetylcholine, the neurotransmitter, hooks up with the receptors in the sarcolemma, and then this makes it more permeable to sodium ions. They rush inside the cell, and this is called depolarization, so that there's more negative charge on the outside now. And then there are T-tubules that we saw that went deeper inside a muscle fiber, and these bring this change inside. Depolarization will stimulate the release of calcium ions from the sarcoplasmic reticulum, remember where they were stored. And then the calcium ions will bind to troponin and tropomyosin. Troponin and tropomyosin are the relaxing or the inhibiting proteins, so when they are active, the muscle cannot contract. But calcium binds with them and ties them up, so therefore the contractile fibers, myosin and actin, can cause contraction. Myosin needs ATP to work, but cross bridges will attach to the actin filaments, which are those on the outside attached to the Z-line, and pull them in towards the center of the sarcomere, the contracting section, and therefore it will shorten. And when this shortens down all these little sections of the muscle fiber, the muscle gets shorter, and the whole muscle and the muscle fibers contract. And that is how the muscle contraction occurs. Now, it can't stay contracted forever because it would just wear itself out. So the message has to stop. And that's when cholinesterase gets rid of acetylcholine. And then the potassium goes to the outside, repolarization, and then quickly they go back to the way they are, the polarized state, so it can happen again. And this talks about that cholinesterase inactivating the acetylcholine. And the process of being polarized, getting the message, depolarizing, having the fibers contract, that whole series is called a twitch, and that's a single muscle fiber contraction. If we want to sustain a muscle contraction, we want to keep our arm bent, it's not just one long message. It's a series of short messages following each other. So the message must go, the message must stop, depolarize, repolarize, but it's ready to go again. And the different fibers take turns and create a sustained contraction. But if no further messages come along, then the muscle can relax. And that's why with our antagonist, if one did a movement, but you want to have the other muscle take over to have the opposite movement, these muscle fibers in the one that did your flexion need to relax for extension. And we can see that here. If we look at the big circle at the top on the left, we see the sarcolemma, we see the T-tubules, and we see that the sarcoplasmic reticulum has lots of calcium. Below it, we see the thick myosin inside, kind of light tan color. We see the blue thin chains, the actin, and then we looked at a little more intense visual of that on the bottom. We see the actin, but we see that troponin and tropomyosin are hooked to it. We have to get those inactive for the muscle contract. So when depolarization occurs, we see that sarcoplasmic reticulum. Now we're looking at the picture, large circle on the higher one on the right. We see the calcium is going out, going down there into the contractile proteins on the actin, where the troponin and tropomyosin are. And in the lower picture, we can see how they bind to that and make them inactive, so that those myosin cross bridges, those little sort of clubs on the end, can get into the sites, the binding sites of the actin, and then the myosin will pull it in, so that you can see the difference between the large one on the right and the large one on the left. That myosin has pulled the actin. It has shortened the sarcomere. All sarcomeres shorten, the muscle fibers shorten. Lots of my muscle fibers shorten. The muscle shortens, and we know that its action then is to pull. The term tetanus in here isn't looking to the disorder caused by a bacteria. This just means that if, here again, we've got continuous nerve impulses, like I said, not just one big long, but a lot of them, integrating, working, so that way we can have effective movements. Since for a muscle fiber to contract, which makes the muscle contract, it needs that nerve impulse. And we say that muscles are paralyzed when they don't get a nerve impulse. And obviously if a nerve or the spinal cord is injured or broken, the message can't get through the nerve to get to the muscle. On the other hand, in a cerebrovascular accident, it's the brain that can't even begin the message. And of course, if muscles are not used, then they atrophy. They're not as effective. So that's why people with paralysis often have physical therapy. Somebody moves their muscles for them, in hopes that if some nerves can be regenerated or someday spinal cord injuries can be repaired, these muscles will remember what to do and will be ready to go. So we hear the term exercise physiology. It's important to maintain homeostasis. So moderate to strenuous exercise is good. We call that physiological stress. And here again, if you don't use it, you'll lose it. So the muscles will contract. We know that they need more energy because we just saw where it takes ATP for myosin to pull the actin in. And in order for more energy, we need more oxygen and glucose. So we're going to breathe harder to get the oxygen in. The circulatory system, the heart is going to pump faster, get that blood moving to bring the oxygen and the glucose to the muscle cells. It also affects the integumentary system because remember energy, the equation for that, one of its byproducts, things that the body could use but were made, was heat. And if the heat gets too much, we need to remove it. So that's when, if you recall back to the integumentary system, we have the potential for the arterioles to go up closer to the surface, and we have the potential for the eccrine glands to make sweat, so evaporation can be cooling. And of course this affects the nervous system too, because it needs a nerve impulse to move. So it's exercising the nervous system. We know that part of the nervous system, and we'll reiterate this coming up in the next topic, coordinates contractions. And of course the medulla, part of the brain, regulates heart rate, respiration rate, and that fact that the arterioles will expand or contract, or dilate or constrict. With aging, the muscular system does deteriorate. So muscle cells die and they are replaced by fibrous connective tissue or fat, and of course that can't cause contraction. So often our older patients, their muscles are a little slower to contract and their strength decreases. So, here again, looking at our older patients, we cannot expect them to, an 80-year-old, to do what a 40-year-old did or what that person did at 40. And, they're not going to be as strong, and it's not going to happen as quickly. Also, remember when we discussed proprioception, the balance, the knowing what's going on. Well, that isn't as effective. So the older folks are more unsteady. There's more chance of loss of balance. That's why there are loss of falls. So today in the offices we are, giving information to our older folks to make sure that their homes are safe so that we have less potential for these things to happen. And as I mentioned earlier, and we will talk about it as far as with bones, if you don't use it, you'll lose it. So exercise is good. It's important throughout life. We're not saying that you got to be, the distance runner. You don't have to be the weightlifter, but you do need to move, and you need to do it periodically. These muscles need to work because the longer they're working in good condition, or the more frequently, the longer they will work. But here again, with our older folks, they still need to exercise. It may be a little bit less. So that concludes this part of the muscles. We have one more presentation coming up.